hospitals in the National Capital Region are continuously reporting a rise in COVID patients. Let's check the situation at the Philippine General Hospital. Joining us is its spokesperson, Dr. Jonas del Rosario. Good morning, Dr. Jonas. Thank you for being with us today.
Good morning to you and to your televiewers. Thank you for having me.
All right, Doc, what is the situation, the COVID situation right now in the PGH, and how many COVID patients are currently admitted?
We're seeing a steady increase in our admissions. Our ERs are also getting overwhelmed with a lot of visits. Right now, we have 312 confirmed COVID patients admitted to PGH. So that's the highest so far since the last surge from Delta. And that represents close to 90% of our bed occupancy.
Doc Jonas, how many of these patients are exhibiting mild to moderate symptoms, and ano po yung profile ng mga patients? Pediatric cases po ba, vaccinated or unvaccinated?
Looking at the distribution, about 65% are mild to moderate. And then the rest are belonging to the severe to critical. We have a lot of patients. We look at our demographics and try to compare it to the previous surge. Interestingly, about 90% of our patients admitted to PGH have what we call incidental COVID. I mean, they came in not because primarily of COVID, pneumonia, but more of their worsening medical condition, and it just so happened that they have COVID infection as well. So only about 10 to 12% are coming in primarily for COVID. The use of ventilator and high flow oxygen is much less compared to the previous surge. Yes, we do have kids coming in fact, increasing numbers. We have to expand our pediatric COVID ward, and we're looking at expanding it to about 30 to 40 beds if we can. In pediatrics, again, almost about 60% have significant comorbidities, leading to moderate to severe. A lot of our ICU patients, those who are severe to critical, most of them really are in the ICU because of their worsening medical condition, not because primarily of COVID pneumonia, which is much different before when during Delta surge, most of our patients are really coming in for severe pneumonia and really needing high flow oxygen or mechanical ventilator.
Yes. Dr. Jonas, can you tell us what is the situation in your emergency room? Are you still limiting services to COVID-related concerns? And what is the estimated waiting time before patients can be attended to in the ER?
Well, we try to fast track our triaging now. There's a better system because now we're able to open a few more beds to our patients. There was in a way, a logjam for the past week because there was a lot of non-COVID patients still admitted to PGH, and these were patients who came in during the holidays, and it was not easy to suddenly convert some of our wards to COVID again. But now we're able to do that. We're still not admitting any non-COVID elective cases. So we're limiting to life and limb-threatening emergencies. Our OB maternity ward has just recently opened again. We closed it for about a week. Now I was told that we can again accept women, who are COVID positive to deliver, because we're only one of the few hospitals which are willing to admit a lot of these COVID patients. PGH is accepting, again, mostly COVID patients because we are a COVID referral center.
Okay, Doc, let's talk about the healthcare workers in the PGH. A few days ago, it was reported that the PGH is operating on a, quote, crisis mode, as many of your staff members are either infected with COVID or in isolation. Now, how many healthcare workers are currently unable to work?
Well, almost every day we have about 100 to 120 healthcare workers getting infected. So if you start counting from the start of the year, January 1, up to the present, we almost have about 1,100 healthcare workers who got infected. Luckily, some of them are coming back now, but still represents about 25% of our workforce. We also, for every one infected, about 2 to 3 have to be quarantined because of significant exposure. We had to shorten our quarantine protocols because if we actually allowed them to um, to go on quarantine for a longer time, you won't be able to basically run the hospital because probably about 60 to 70% of our healthcare workers will be tied up with either being in isolation or in quarantine. So, yes, we're still in a crisis mode and we have what we call task sharing because trying to mobilize as many healthcare workers that we have, so different departments are helping and pitching in. So far, with that strategy, we're able to get more people to come in, so less quarantine time, and so they're able to come back and report and augment our
Right.
workforce.
Okay, stay safe, Doc, and thank you for your time this morning. PGH spokesperson Dr. Jonas Del Rosario.